Well, GLP-1s, or medications like Ozempic, Wegovy, and Zepbound, were originally created to treat type 2 diabetes, but they're now widely prescribed for weight loss. And for people taking them, some say they're seeing hair loss since using the drugs. However, hair loss hasn't been listed as an official side effect of those medications.
So, one of the big questions remains tonight: is hair loss a side effect of taking these drugs? Board-certified dermatologist and founder of M Beauty Clinic, Dr. Tess Mauricio, is joining us now with a breakdown of what recent studies are showing. Dr. Tess, great to see you.
Great to be
Thanks
here.
For coming in. Let's just talk about it. You know, a lot of these drugs are getting more and more popular. Is this a side effect that you're seeing?
Yes, well, a lot of people are concerned about it. And like Maria said, it's not a listed side effect, although the FDA is actually looking into it because of potential correlation. Some clinical studies now are showing that compared to placebo, it can be about 3 to 5 times as many people complain about hair loss. So it could be an issue, but definitely in our clinic, we definitely hear anecdotal studies and people who are on these medications saying they're getting clumps of hair, they're seeing hair loss in the frontal hairline, their crowns,
things they've
their
never
hair.
seen before.
Yes, and their hairstylists are bringing it to their attention. And so I think, the key is there could be a correlation. There are further studies that are happening, but it's definitely something worth noting if you're on the medications. But the good news is you can be proactive about it so that you don't get a lot of hair loss.
So skinny or bald, I mean, I guess that's the choice at this point.
I know, right?
But it does make sense, though, doesn't it? If you block nutrients from your body, something's going to suffer.
Absolutely. So we feel in the medical field that it's not necessarily related to the medication itself, but instead the stress of rapid weight loss and nutritional deficiency. So anytime the body is stressed, you get in a shedding phase. So we call that telogen effluvium. And this could be what's going on when patients lose, a lot of weight rapidly. And then also because these types of medications suppress your appetite, slows down your gut motility, people have to almost force themselves to take in calories. So they could be deficient in protein, vitamins D, E, zinc, biotin, and they can develop anemia. And so all of those can contribute to hair loss.
So it's not necessarily this type of weight loss drug,
Yeah.
but maybe any type of weight loss drug. Yes. Or rapid weight loss is like lacking nutrients. Is that
correct?
What we're saying?
And telogen effluvium is something known to dermatologists. We see it a lot, and it doesn't have to necessarily be just weight loss, but just overall emotional stress. If you've been sick, you can see this, hormonal changes. And also sometimes now they're talking about, do these medications alter hormones, because you do change your fat content of your body. And so all of these need to be investigated, but definitely we're seeing it. People are complaining, but the good news is we do have great treatments.
So it's not permanent.
Yes, for the majority of patients it is a temporary issue, and that once your weight is stabilized and that you are doing supplementation, you can get your hair back.
What other things could be causing, hair loss if it's rapid like that, if it's not, all these people who are on this drug and seeing the same results?
Yes, so definitely, if you are experiencing hair loss, see a board-certified dermatologist, because there are other reasons. You definitely want to make sure it's not some type of nutritional deficiency, it's not anemia. Thyroid issues can cause hair loss as well. Hormonal issues, if you're around perimenopause, menopause, those issues. Medications, some medications, this is a true potential side effect. So there are other conditions, and there are different types of hair loss, and sometimes we need to do a biopsy to figure out what's going on.
And there are treatments to help.
Yes, that's the great news, right? So you don't have to pick skinny or bald. So you just have to get good intervention. And usually at M Beauty Clinic, we create a protocol combination where we're combining nutritional supplementation. There's incredible lasers now, platelet-rich plasma from your blood, also exosomes, combination therapies really work in stopping the shedding and also restoring hair.
And I can say it works because I've actually had you do it before. Just along my hairline. So there you go.
Mine's going.
You have great hair, Andrew.
Thank you.
It's all about being proactive.
Thank you. I appreciate it. Dr. Tess, great to see you. Really good information for everybody out there who might be using all this stuff.
Thank you so
much.
much, as always.
And we'll take